So I was reading through the February 2nd New England Journal of Medicine the other day, scouting for new video ideas. And I came across this case report of this 14-year-old boy who presented to the ER with history of episodic headaches and vomiting. It turns out that it's a case of Echinococcus granulosis infiltrating the brain, a rather unusual location for that pathogen, more about that later. But I kept thinking, and I thought it would maybe make a good video idea to maybe shine some light over some of the unusual causes of headaches. I mean, people are familiar with primary benign headaches like migraine and tension headaches and cluster headaches. Even trigeminal neuralgia can be considered as primary headache. But knowing these conditions and their associated signs, in my opinion, can be life-saving in some cases. Plus, they're fairly easy to spot. So first things first, what's happening here? This is called an Hydatid cyst, and it's caused by this little guy, Echinococcus granulosis, and it's transmitted by ingesting dog feces. You may have said, what a weird statement, Fetty, okay? Who's going around eating dog poo-poo left and right? Well, to that I say, you don't really have to directly come to close contact with the contaminated feces. You can simply eat contaminated food like herbs or strawberries that some of you probably grow proudly in your backyard. Actually, eating livestock is one of the most common transmission pathways that this pathogen can be transmitted to humans. And it's what probably have happened with this boy because he used to live in a farm. Now, as I'm in the process of shattering your dream to move to a far mountain in Japan and maybe grow and eat your own food by yourself, synchronizing with nature, training Kung Fu, let me double down by saying that the rupture of this cyst is associated with anaphylaxis and a higher mortality rate. So this is no joke, guys. But even without rupturing, this cyst can expand and compress the surrounding structures in the brain, and in this case cause an increase in intracranial pressure, which translated to headaches and vomiting. You gotta remember, guys, that the brain doesn't have pain receptors. A patient could have the most aggressive and expanding tumor on the planet, God forbid, but feels no pain. The pain itself comes from the surrounding structures, like the meninges, the nerves, and the vasculature, and an increase in ICP will actually expand the pressure inside the cranium and cause those structures to be irritated, thus giving us headaches. And now that we cleared out the concept of headaches and pain receptors, I think it would be an easier task to understand intracranial hemorrhages. And intracranial hemorrhages can be divided into multiple classifications like epidural hematoma, subdural hematoma. You probably have heard of them before. But for the purpose of this video, we're only interested in subarachnoid hemorrhage because that's the one that's notorious for the amount and intensity of headache that it causes. And actually, I'm not gonna talk a lot about this one because the patients that have had this kind of headache describe it as the most and the worst headache that I've felt in my life. So if you ever had this headache, God forbid, you would probably know that you should rush into the hospital immediately. And finally, the final condition that I wanted to mention, and the condition with the worst prognosis, arguably. Well, you could argue that subarachnoid hemorrhages are worse, but this is an important one and a common one: meningitis. Now, this can be caused by a variety of microorganisms, both bacteria and viruses, and as you guys may know, these little guys, each one of them have its specific symptoms and associated with different signs, but one thing that is usually always present is fever and malaise. It's an infection after all. But what should really set you off to suspect an involvement of the meninges is the meningismus signs. One task that I used to ask my patients to do back in August when I was in my neurology clinical rotation is to sort of have the patient laying down in a horizontal position and gently flex the head and the neck of the patient. And the patients that have meningitis will often describe a stiffness that will present as difficulty to make the move easily and without pain. And there are also two other tests that you can do from the comfort of your own home. You can ask a family member to perform this test on you, and if positive, these tests can actually indicate the presence of meningitis. They're called Kernig and Brudzinski tests. So the first test you want to do is Kernig's sign, and Kernig's sign is based on the fundamental fact that the meninges don't only cover the brain, but they extend and cover the whole spinal cord. So what you want to do is you want to have your patient laying down in this horizontal position, and then you want to sort of flex his the hips and keep his knees in this dorsal flexion position, and then you want to gently start to extend his knees this way, and the patient will describe some pain, and you will find most often resistance trying to do that movement, and that will most likely indicate a meningeal involvement, because that actual movement stretches the meninges in the back of the spine. So that's one test you want to do. The second test you want to do is called Brudzinski's sign. So these are two tests, Kernig and Brudzinski's sign. And what you want to do is you also want to have your patient laying down in this horizontal position, and then you want to gently start to flex his neck and head. And remember, guys, stiffness in the neck is the most relevant symptom of meningeal involvement. So you want to try to gently flex his neck, and you want to see the patient slightly raise his hips, and he actually does this involuntary movement to try to ease the pain, and that's also a relevant symptom of meningitis. Thank you, Alush. No problem. Shout out to my friend Ali for helping me and actually acting the patient's role in that previous clip. And again, these tests can be safely performed at home. You can ask any family member and he can perform those tests on you. But you gotta keep one thing in mind, that if you feel sick and if you have actual fever and signs of an infection, you probably should take good care of your hygiene. Make sure to isolate yourself in a separate room, and the family member that will come and perform this test on you should wear a mask, and you should wear a mask as well, because some of the pathogens or microorganisms that cause meningitis can actually be transmitted easily from human to human. So yeah, that basically says it all. That's what I wanted to mention in this video. There is obviously a dozen of other causes of headaches, like neoplasms, for example. Brain tumors is a big cause, but as we said, the brain doesn't have pain receptors. You have to have an expanding tumor that it actually compresses surrounding structures that the headache will appear. But if there's one thing that I want you to take from this video, is that one thing to keep in mind is that when you ever experience a headache, especially when it's over a couple of days, you should look closely for any sign of a neurological involvement. Any neurological sign. I mean, blurry vision, weakness, focal neurological deficit that can present itself as weakness in one limb, or numbness, paresthesias, seizures, blurry vision, vision problems, any sort of a vision problem. So if you actually have a headache associated with one of those symptoms that we just said, that strongly suggests that your headache is of a neurological cause, and you should rush ASAP into a neurologist. Delaying the diagnosis only makes the prognosis worse. And actually, a lot of these conditions are easy to treat, so don't be afraid and go to your neurologist, please. That sums it up, guys. I hope you found the video informative. I hope you liked the video. Please make sure to press the like button and subscribe. And as always, stay safe.